So this is past medical history part 2. In part 1 you heard about lung carcinoma, but really any kind of cancer we need to know stage and grade, treatments and side effects of treatments. In past medical history part 2 we also need to do the same process for medical conditions. So you probably were told to record whether the patient has diabetes or hypertension or hyperlipidemia. This is a standard past medical history list. But what you really are trying to do is stratify this risk. How likely is it that whatever the patient is here for is due to one of these problems? And so for hypertension, we'd like to know what their last and current blood pressure is. For diabetes, we'd like to know what their hemoglobin A1C is. For hyperlipidemia, we'd like to know their numbers and whether they're currently on treatment, for example, statin therapy. Because if you just write hypertension, diabetes, and hyperlipidemia, you really haven't stratified the risk that whatever their neuro-ophthalmic problem is as being caused by their past medical history. And so in every patient who I see who has medical problems, we check on the control. Is it well controlled or poorly controlled? We correlate their disease with their med list, because the patient might even deny that they have any of these disorders. You might say, do you have hypertension? They say no. Diabetes, no. High cholesterol, no. But then when you get to their med list, they're on lisinopril and the statin and metformin. And when you ask the patient, I thought you said you didn't have these diseases, they might say something strange to you. I don't have those diseases because they're treated. And so there's a disconnect sometimes between what patients think is their past medical history and what their actual past medical history is. And one of the things we can do to reconcile that is looking at their mid list and correlating it back to their past medical history. So in summary, in past medical history number 2, for medical problems, not only is it important to know what they have, but how well is it controlled and what treatments are being given, so that we can risk stratify these risk factors for whatever the patient is complaining about.